Welcome, everybody, to this month's edition of Cancer Prevention and Wellness. This is a monthly program sponsored by the Cancer Survivors Park Alliance. We have with us today um, Phillip Gibson, who works for the North Carolina Department of Health and Human Services. Emphasis of the Cancer Control Division, and he is the North Carolina Radon Program Coordinator. We are going to discuss radon, which is kind of a silent killer that we need to be aware of since it's a very common element that can lead to lung cancer in smokers and non-smokers. Phillip got training in the University of Louisville, where he got a BA and also a Master's of Science at the University of Southern Illinois. He lives in Franklin, North Carolina, and I guess in all his free time, he's also a pastor and worship leader at the Alexander United Methodist Church. So you appear to be a busy guy, and I appreciate you taking time out of your busy day to speak to us about something that we all need to know about.
Well, thanks for the opportunity. I think it is something that we all need to know about. My family has a number of people that have died from various cancers, including lung cancer. And I suspect that many of those who are watching have experienced cancer, right? Whether it be family members or themselves. So I do think that this is an important topic. That's why I've been involved for roughly 14 years. My job with the Department of Health and Human Services is to educate people about radon. But I want to acknowledge that there is a person in every state and tribal community across the nation that does what I do, whether it be education focused like myself, or some states that have a policy that deals with different components, whether it be certifying people or requiring mitigators to be licensed, so forth. So there are some states that have regulations. South Carolina also has a person, much like myself, who is focused on education. So while everything that I'm going to talk about is going to be North Carolina focused, I want you to understand that this is completely relative to South Carolina as well. So the whole state, the coast to the mountains, if you will, just like in North Carolina, from the coast to the mountains. So I hope that this is a benefit to everybody. I do have a short video. It's about a minute or so long, and it kind of encompasses everything that I'm going to talk about. So let me play that, and that way it gives us equal footing to go forward.
Radon is the second leading cause of lung cancer in the U.S. and the #1 cause for non-smokers, according to the EPA. Inhaled radon breaks down into radioactive particles that attach to your lungs, releasing bursts of energy that can damage lung tissue over time, causing cancer. Radon is responsible for over 21,000 lung cancer deaths annually. In North Carolina, 77 out of 100 counties, including coastal areas, have homes with unsafe radon levels. This isn't just about the land. Building materials can be the source of radon too. Don't rely on maps to know if your home is safe. Test your indoor air. Whether you own or rent, testing for radon is crucial. Homeowners can install mitigation systems, but renters need to work with their landlord. Visit radon.ncdhhs.gov to find testing kits and solutions. Protect your family by testing today. It's simple and it could save a life.
So this brief introduction has got a couple of points that I want to put some depth to, as well as some clarity or updates. So one thing to update is we did just produce this video in March of 2025. And since then, we now know that 90 counties of North Carolina, which there are a total of 100, have had at least one test that's shown a radon level of 4 picocuries per liter or more. And 4 is when we began making a strong recommendation for mitigation or to have a system installed that would lower the level. And I will get into what that system looks like. The other thing to also put some depth to is where uranium exists, which is the beginning point or what is decaying in our rock and soil that releases radiation that then our homes are drawing inward. And when we quarry that rock or aggregate and we turn it into sandstone or gypsum board or concrete, those materials may have uranium in them that is in fact decaying. And so when high-rise, mid-rise condominium buildings, schools, commercial buildings are built, then the materials in that building may in fact be the source of elevated radon. In the case of single-family homes, it would be typically from the ground. So when the uranium in the ground is decaying, it's releasing radiation, making itself available on the surface for a building to draw it inward. So radon is an element that you would find on the periodic table. So going back to some chemistry, if you haven't had it in a while, and it is in fact a radioactive particle. We call it a gas, but really it is these, as the video was showing, elements of energy or particles of energy that when we inhale it, and that's how it gets into our body, is by inhaling it, then that particle is decaying and releasing more energy and potentially is impacting negatively the cells in our lungs. And of course, if the cells are damaged repeatedly and it doesn't heal properly, then that's where cancer begins developing. So I want to note a couple of things about the characteristics of radon, which are important to know as to why we test, where we test, and how we test for radon in our homes. First is just to acknowledge that radon is heavier than air. It's 7 times heavier than oxygen. So the greater concentration is going to be at the lower level of your home rather than the upper floors. So when testing, we're testing for exposure. So you would not test in the crawl space, for example, because no one's living in the crawl space. And you wouldn't test in a basement that is a space where you're just storing things. It's where you're being exposed or living. So an office, a bedroom, workout room, whatever that may be. If it is happening in the basement, then you will test there. If not, then you'll test on the first floor. The other thing is to point out how rapidly radon is decaying and turning into other elements or things, if you will. And that is a half-life of 3.7 days. That means if I had some amount of radon in my hand and it was static, like no more is coming into it, then in 3.7 days, half of that will have decayed into other elements. And the decay process continues, right? But what we know is that it's not static, that more is being produced by the ground. So it's just replacing what has decayed. And it's important to know that because I don't want you to think that like, say, carbon monoxide or other things that we may breathe are building up, but rather it comes into the environment, it's decaying and other things. So the amount, which is what we're testing for, is going to change over time. So I've mentioned the decay process, and I'm not meaning to try to turn you into a radon technician or a specialist in this. And I'm going to get a little bit in the weeds, because it's important to know about this decay process. So if you see in the illustration, uranium is kind of the beginning point. And as it decays, eventually it decays into radium, and then eventually into radon. And during each one of these transformations, if you will, or the decay process, there's energy that's being released. And that could be in the form of alpha, beta, or gamma. So as Dr. Guidry will probably share with you that when you go to get an X-ray, it would be gamma. The radiation is going through your body. But an alpha particle, which is what radon is, can only get into your body by inhaling it or by ingesting. And what I mean by ingesting is that there are areas in North Carolina that the geology is releasing radiation and is coming in contact with private well water. And when the well water enters the home, it's being released into the indoor air by way of the spigot being ran or the dishwasher being ran or the washing machine. And then it's available for us to breathe in. But we can also drink that water from a private well only, not a city water, not a community well, but private well water. And we know that that can result in stomach cancer. And we also know that radium, when ingested, has shown itself to cause bone cancer as well. Now, the rest of these slides are all going to focus on lung cancer, but I want to just make you aware of this decay chain and how it may interact with other parts of our body. And all these things, uranium, radium, radon, are all radionuclides. So just think of that word as being the umbrella word for all these other elements. So, and just to kind of bring all of that to home, if you will. So the alpha particle it seems as though in this illustration that it might be weak because it can't go through paper, but it's still a very powerful release of energy. But again, it can't go through paper, so it's not going to go through our skin. Beta, however, can go through paper, but not aluminum. And gamma, as I mentioned, is like X-rays. So at 59, I don't wear a lead apron anymore because I don't go to I don't have the chances of having children and such. But anyways, the point is that gamma cannot go through lead, and that's why we wear lead aprons when we get X-rays. So, as I've mentioned, uranium is in the ground. It's in all rock and soil throughout the world. So, every state, every country has some kind of educational program to try to get people like you to actually test their indoor air for radon. And it's really oftentimes a voluntary effort because there are no laws, rules, or regulations in North Carolina, and I do not believe in South Carolina either. So it's up to you to test, and that's including water. So typically in a private well, there's no requirement by at least North Carolina law, and I certainly don't think it's in South Carolina either. There's no requirement to test your well water either. And so while it's mainly in the ground and it's decaying, it being uranium, and radon gases or elements are being released, then they come to the surface of the ground and they are drawn in by the negative pressure inside our homes, or the suction or the vacuum effect of all homes. So when we feel drafts, when the air comes in to our homes, that's the home drawing in, or the building drawing in those gases. And it will do the same for radon if radon is available to be drawn in. But we also know that the building materials, as I mentioned, can be a source. So you could be on the 8th floor of a condominium building and have elevated radon level because the building materials are what the building is drawing in, or the gas, that is. Now, radon has these characteristics. You can't smell it, you can't taste it, you can't see it. And because of those characteristics, people do confuse it oftentimes with carbon monoxide, because carbon monoxide you can't see, smell, or taste. And so oftentimes people will tell me, oh yeah, I have one of those detectors in my home. It's plugged into my wall. And really what they're talking about is a carbon monoxide detector. Now, we don't recommend the plug-in devices that are on the market. You can be satisfied with just what we call a passive test. It doesn't have any machinery to it. It can be like a cardboard pouch or a little petri dish. They come in different forms. And on our website, we have a list of what companies to consider when buying them. Even though we can't see it, smell it, or taste it, we can use this device called a cloud chamber that allows us to see the energy that's being released during the decay process. Now, this machine or cloud chamber is really simply a box that is holding air from that room in that box, and the air inside the box has been cooled down considerably from, I don't know, either dry ice underneath the box or maybe a refrigeration unit. There's a variety of ways, but the intent is to cool off the air inside the box. And then there's isopropyl alcohol that is releasing vapors inside that box, and we can begin seeing the release of that energy. Now, this first room that they're showing you the results of has a very low level of radon, and you see the white lines shooting on the screen there. That's radon being released, or energy being released. So you can see there's only a few bursts that happen there. So that's a low level. And then I'm going to go ahead and speed up to the point where they have now tested this basement bedroom and shown that it was 100 picocuries per liter of radon. And so that visual that you see is, in fact, 100 picocuries per liter of air. Let me just talk about picocuries. So pico is certainly the size or the amount of. Curies is named after Madame Curie, who was part of her and her husband Pierre, did a lot of work around radiation. And Marie Curie, which my cat is named after, won 2 Nobel prizes in physics. So in any case, that's just kind of a visual of what 100 picocuries per liter of air looks like. So I've talked about how it's in the ground, or it could be in building materials. And then there are the negative pressure, which is drawing gases in, and it's drawing it through different pathways. So one of the strategies for dealing with elevated radon levels indoors is to kind of minimize or seal up the pathways. And pathways would be like the cracks in your foundation or floor, or hopefully you don't have any cracks in the foundation, but there are settling cracks and such that happen over time. Certainly the construction joints where your wall and floor come together, or voids like holes around your electrical or plumbing and so forth. So those are pathways, right? The water supply, as I mentioned already, could also be a pathway. And people call me oftentimes, and they begin by saying, I live in, and whether it be a zip code or a subdivision or a county, or they could say, I'm considering buying a home in this specific location. And what they want from me is they want to know, is there a high risk of radon to be in the home that they're considering or the home that they live in? And my response always is, you have to test in order to know. Because you could be that one home in the subdivision that has a high level or doesn't have a high level. You won't know until you test. And oftentimes people still persist and they want some kind of predictor because they don't want to spend, say, the $20 on a test kit, which is about what they cost. So the predictor that I can only give, which is a national research number, which is 1 out of 15 homes in the United States has an elevated radon level. So that's the best I can do in terms of a predictor, kind of a risk assessment. I want to note the 800 number that's below. And there is a National Radon Program Office that's out of Kansas State University. So if you know people who are in need of communication by Spanish, they actually manage a Spanish hotline. So by calling that number, you can definitely connect with people. And this image is part of also our social media campaign. So if you're part of an organization or you privately would like to help educate others about radon, we have about 300 social media items like this that are in both English and in Spanish. So as the video said in the beginning, it said 77. Of course, more recent data has shown that 90 of our 100 counties in North Carolina have elevated radon levels. Now, there is a map that's a national map that is called the zone map, and it shows yellow, orange, and red counties. And in fact, the South Carolina map will also show the same. For North Carolina, there are only 8 counties that have been shown in red. Now, that map, which was produced back in the early 1990s, was intended to just help local governments, state governments, with knowing where to focus limited money or personnel on what was a new topic. So radon in homes became really an issue that we began doing things about, like education or policies, in the early 1990s. That map was not intended to help a consumer figure out should they test or not. And unfortunately, that's what's been used. So this map shows that of all the 170,000 tests that have been conducted since 2010 until 2025, so we gathered data from 3 national companies who sell test kits or do testing. And we found that there was at least one test in that county, or the ones that are in red, that was 4 picocuries per liter or more. Now, you may think, well, you could do a risk assessment. Well, I can't, because many of these counties have only had roughly 0.1% or a very low number of homes tested in each county. So the proportion of homes that exist in that county, the majority of which have not been tested in the past 15 years. So my effort is to educate people and hopefully get them motivated to test their home to prevent lung cancer. So again, the radon is released from the ground. It's going through the pathways to get into the home itself. It's the negative pressure that's drawing it inward. And then we're exposed to it, and we can inhale it, and it can damage the lungs. So how does the number that you test or get from the test correspond to your risk? And I definitely want to emphasize that this is not an absolute. Like carbon monoxide exposure, you're absolutely going to die and die suddenly from that exposure. But for radon, we're talking about lifetime exposure. It's not like, but I'm going to use the comparison of you eat a lot of sugar, you may end up with diabetes, right? If you're exposed to a lot of radon or high level over a lifetime, your risk for radon-induced lung cancer goes up considerably. So you've tested your home. Let's pretend that you got a level that was 4 picocuries per liter. Now that level, when you tested for no less than 48 hours, because you want the average level, not hour by hour level. And the reason is because when the weather changes outside, the suction or the vacuum effect of your building changes each hour. So the level of radon that's being drawn inward is going to change. So think about it also in seasons, the summertime versus the wintertime. When it's colder outside, it's warmer inside, your home's going to draw gases in. That's why we recommend to test during the wintertime if you can. That way you have a better understanding of the maximum level that you're being exposed to. So let's go back to the table. So you get your test result back. Your average level over a period of no less than 48 hours is 4 picocuries per liter. Then your risk is defined by either as a never smoker, meaning you've smoked less than 100 cigarettes ever in your life, or an ever smoker, which is a person that smoked 100 cigarettes or more ever in your life. So your risk at 4 picocuries per liter exposure over a lifetime for a never smoker is 730 out of 100,000. Or you could also look at it as 7 out of 1,000. And we used to talk about it in terms of thousand per thousand. So if I continue to say that, just know that I'm used to saying it that way. That's why. But anyways, 7 out of 1,000 is your risk at 4 picocuries per liter as a never smoker. But your risk goes up by tenfold if you are an ever smoker. So it goes to 62 out of 1,000. Some people fixate on 4 picocuries per liter as sort of anything under that is safe. And I want to be clear that no level of radon is safe. If your level was 2 picocuries per liter, there still is a risk. So it's 3 out of 1,000 or 3.7 out of 1,000, right? For a never smoker. But your risk as an ever smoker is 32 out of 1,000, which is actually higher than a never smoker at a level of 4 picocuries per liter. So, like North Carolina, we regard in real estate transactions the level of 4 picocuries per liter or more to be a material fact, which means that during the real estate transaction, if a high level of 4 or more is found by testing, then that has to be communicated to all parties involved in that transaction. Kind of like if mold was found, right? Or there was a crack in the foundation or something like that. Those are material facts. So what do we do with those levels? Well, EPA recommends, which means South Carolina, North Carolina, pretty much every other state and tribal community is going to make these recommendations based on certain levels. So starting from the bottom, if your level, when you test it again for no less than 48 hours on the lowest level that you're going to be exposed, then we would strongly recommend at 4 or more to mitigate. So to hire a certified professional, and there's lists of those persons on a variety of websites, and I can show you later. If it was between 2 and it should be 3.9, then we ask you to still consider mitigation, but it's kind of a lighter statement. And here's the reason why. Certified professionals, the people in the industry, oftentimes, I don't know of anybody who will guarantee to bring a level under, say, 2, but they will guarantee in writing to bring it under 4 picocuries per liter. So there's that. And then, of course, if your level is under 2 picocuries per liter, then we ask you to just continue to test every 2 years, because what's decaying today may change over time. It could go lower, it could stay the same, but it could go up. And you want to keep a handle on that by testing. So in North Carolina, for all 100 counties, we have guidance documents. These are a little bit technical with intention, but it's also to kind of share a little bit more information. You may or may not be able to read this. These are all available on our website. But the main point for all consumers in North Carolina is what's in the top right-hand corner. So if you live in Swain County, which is actually one county or 2 counties over from me right now in the mountains, then we recommend that you first test your indoor air. If you have a high level, then test your well water if you're on a private well to see if that's the pathway to get for the elevation in your home. If it is, then you know that's where you need to spend money to install a mitigation system for your well water, which is going to be different than a mitigation system for the indoor air level. So if you treat the well water, if that's where the main source of your radon is coming from, then your air level will go down.
Just as an aside, Philip,
sure.
We do have, we are recording this lecture, so the entire lecture, including some of these more intricate slides, will be available at our website, cancersurvivorsparkalliance.org, and go to the program section, and it'll be there. And there's the capability on that to enlarge this type of slide so you could see it more. But if you're writing furiously, the websites and the phone numbers, those can be obtained at your leisure. And of course, you probably will find that this is useful for friends and relatives, and you might want to refer them as well. And so just if you want to find this lecture, again, the website is cancersurvivorspark.org.
Thank you.
Yeah.
Yeah, that's awesome. Thank you so much. And just to point out, one of the points in this document, or this fact sheet, if you will, is how smokers or people exposed to secondhand smoke are certainly at higher risk. But I want to acknowledge that children, during the time that their lungs are developing, what I'm getting ready to say is not to imply that children can get lung cancer. That is not what I'm saying. But what I am saying is that when children are exposed to elevated radon levels, then during the time that their lungs are developing, they're breathing faster, their lungs are more sensitive, and it sets them up for a higher risk later in life to having lung cancer. It's like anything else. I have two children, but my children are now 34 and 26, right? So their lungs are no longer developing in the way that a toddler or an infant and so forth would be. And like with all of our children, though, we're wanting to protect them from certain things to give them a super chance of success, whether it be health or otherwise later in life. So just be aware that if you're not doing it for yourself, then maybe children in your home. The other thing is private well water. The point that I've not brought up yet is uranium actually has a public health standard. And uranium that is found in the ground, again, that is interacting with groundwater, and then we're piping that into our homes and drinking it. You may want to consider testing for uranium because you may have a low radon level, but you could have elevated uranium. And that can lead to kidney damage, kidney toxicity. And certainly, the decay process that I've already mentioned could result in other things. So just a consideration in testing for uranium. So I did briefly mention children as being vulnerable or susceptible, not susceptible, but sensitive to. So we have fact sheets that are on our website. And one of the things that we're working to do is educate daycares, educate schools, because their exposure to radon is not just at home, but also in these other environments. So our hope is, again, this is a voluntary process. Our hope is that leaders within or owners of daycares or schools or even commercial buildings in North Carolina, we have, I know of banks and real estate offices and other commercial type, not retail, but office buildings that have tested and mitigated for radon. Again, the only way to know if you have a high level is by testing. And these are representative of, or are the social media items, some of the others that we have to help communicate the issue. So again, radon is a gas that you can't see, smell, or taste. It's the second leading, I have not said that yet. It is the second leading cause of lung cancer in the United States. It is actually the leading cause of lung cancer among non-smokers. So just to note that in the United States, it is estimated that 21,000 people die each year from radon-induced lung cancer. That was in the video at the beginning. In North Carolina, we estimate about 480 people die each year from radon-induced lung cancer. Again, that's not that they were exposed yesterday and died today. It is a slow progression into damage in the lungs. So, if you will, we have a population that is breathing in gases, and over their lifetime, damage is happening. And then, unfortunately, they're diagnosed and die from. Again, here's another social media. This is me repeating things that I've said. And I do that whenever I give presentations. I intentionally repeat items so it will stick with you. And that is, in this case, radon If you are an ever smoker, then your risk is 10 times greater than a never smoker. So again, we went from 4 picocuries per liter, a risk of 7 out of 1,000 for never smokers, and 62 out of 1,000 for ever smokers. So one of the things that has, over time, in the 14 years that I've been in this, but I'm not the only one, your person in South Carolina or people in Georgia and other states across the country, even in Kentucky, have had people call and say, can radon impact negatively my dog or cat? Because their motivation is not necessarily to protect themselves, but they want to protect their friends, right? So the question is, can it do so? And so I teamed up with a nurse oncologist from the University of Kentucky and the North Carolina State Veterinary Medical School oncologist, who happened to be the chair of the program at the time. And together we did a literature review and found that yes, damage can occur to the lungs of dogs and cats. If you have a lizard and you're wanting to know, I'm sorry, I don't know about that. But in any case, what we do know for dogs and cats, is that radon can impact their lungs. We do not, however, have a risk table like we do for humans. We can only say that we know that this radiation that we're breathing in, that dogs and cats are breathing in, leads to certainly lung cancer, but more often it is emphysema and other breathing conditions. So this document also just kind of reiterates which most people know, and that is even secondhand smoke can impact a dog or a cat. So the answer is yes, but how much and what's the risk over time, we don't know. We just don't have that data. So in terms of mitigation, so I've spoken about a couple of building types. One is a single family home and one is a mid-rise or a high-rise condominium building. And this image is how mitigation is done for an existing home, a single family home, not a condominium or a high-rise, mid-rise. Unless it's a condominium that's on the ground with no upper floors, right? Or a townhome. So the point of this white PVC pipe that you see running up the side of this building, that is a vacuum. And there is a point at the bottom end where it's going into the ground, or in the case of a crawl space, it would go in the crawl space, and it's vacuuming out the radon and other gases, and it's discharging or blowing out that up above the eave of the roof. And there's specifics about all this. There's certainly a lot of engineering elements to it. Like, for example, you want the discharge to be no less than 12 inches above the eave of the roof. You're using roughly a 3 to 4 inch PVC pipe. You want to lessen the number of bends so you don't have a lot of restriction. But the major component of this, the only running component, is the fan that's down near ground level. And so that bulge that you see there is a fan that is blowing upward. So it's serving like the vacuum, drawing gases from underneath and discharging them out. And this is where the information I gave you in the beginning is important to know. So radon, again, is 7 times heavier than air. And that's why you want to blow it up above the house, because you don't want it to blow down lower, because it could settle around that space where children could be playing, or a porch could be, or whatever. The other thing to note is that I said radon's half-life is 3.7 days. And that's why we can blow it outside and allow it to continue to decay into other elements. And so it's not going to harm other things because it decays. It's unlike if you had a chemical that you're blowing out and doesn't decay, then it could impact downwind. The other thing is that you want to hire a certified professional, because you also want people to that know how to install a system that won't end up being drawn in by the window. Because remember, the negative pressure in your home is drawing in gases even from the outside. So if that pipe was discharging near a window or an opening, so forth, it could potentially be drawn back into the home at a higher level than it was from the ground. So again, there's some specifics about it all. If you're inclined to install your own mitigation system in North Carolina, you can do so. I think in South Carolina, you can do so. There is a booklet that is called Building Out Radon that EPA created a number of years ago, that's for do-it-yourselfers. We have worked to try to educate all populations in North Carolina, and there has been health disparities, which I will speak about here in a moment, but to try to address this communication issue, or education issue, we've taken this basic fact sheet that you see before you, and we have translated it into the 16 most common languages that are spoken in North Carolina. So we also have a video that's in American Sign Language for those who communicate that way. So this is the basics. These are the things that I've communicated to you throughout this presentation. And it is specific to North Carolina, but nonetheless, it is relevant. Most of it is relevant to anybody in any state. So if you wanted something to give to your family or friends that speak other languages or read in other languages, we have that information available on our website. And then, of course, in North Carolina, I've mentioned that radon is a material fact at a level of 4 or more for those dealing in real estate transactions. And we know that some people are working towards mitigating their homes. This brochure is relevant to even South Carolina. It certainly has our web address on it, but nonetheless, it is things like, what do you need to know, or what would you want from, or what should you want from a certified professional that you're interviewing to hire or to actually hire? Because most people don't know about radon mitigation systems. So it's just simply a front and back, again, 8.5 by 11 brochure. The rest of these documents are all in English only. Once we receive additional grant funds, I will work to try to translate these. But then there are homes that also have existing radon mitigation systems, and we have a brochure that deals with that as well. So health disparities. So over the years, these past 14 years, I've been measuring my own success. And it's not a requirement by me or by the program. Again, I'm the sole staff person for the whole state of North Carolina. So I can measure what it is that I'm doing and try to figure out how to do better. And one of the issues is, or I've been trying to figure out is, am I reaching everybody? Now, this is not just information for me. This is information for you and for everybody else that's interested in radon and trying to protect other people. In the behavioral risk factor surveillance survey that is conducted in every state across the country, we paid to have an additional question added to that statewide survey that CDC requires, the Center for Disease Control requires. And the question that we added was, do you know what radon gas is? Not the best question in the world, but it's one that other states have used, so I used it. And other demographic information was asked of people from the survey, like, do you own your home or do you rent your home? What we found is that if you're a person who owns your home, you're more likely to know about radon than if you rent. So in this case, 63% of those who said they own their home knew what radon gas was or is, and 31% of those who rent know what radon gas is. Now, that's helpful to me because it helps me understand how to increase awareness among people in North Carolina. The same applies to race. What we found was that, now we added the same question, in 2015 and 2019. So this is comparing years among populations. So among Black males in 2015, only 18% roughly knew what radon gas was. That increased in 2019 to 36%. And you can see the other increases, right? And obviously, you can see that white people are more inclined to know about radon than people of color. And that's problematic for us. Um, I should note that those who identify as Hispanic, there was no change. There was no increase. I mean, it's very little, what, 0.8%. But that could be an anomaly of some sort, an exception. So the point there is I thought, well, maybe it's because we need materials in Spanish or other languages. So that's the reason why we did the translations. But as you can tell, there's a health disparity that exists. And this has been found in other states across the country as it pertains to radon. So we suspect that all states are dealing with a similar dilemma. In North Carolina, and I believe in South Carolina, radon is included in state policies like the state cancer control plan. And the reason that this is important is just to know that people in other programs like American Lung Association, American Cancer Society, or your Cancer Control Office, or the Division of Public Health, or a number of others have agreed that radon-induced lung cancer is an issue and it needs to be dealt with. Dealing with it may mean educating people. It may be having requirements for certified professionals. Every state, again, deals with it differently. For us, it's about advocating for an increase in awareness, and having it in a statewide document gives it more professional cred than if it wasn't, right? And then in North Carolina, which I believe we're the only state that has it included in our state health improvement plan. So this is a different document, but it's something that are goals that are set by agencies. And so this gives them guidance. And the state health improvement plan also impacts community health assessments. Every state that I'm aware of has community health assessments. So each one of your either counties or multiple counties may come together and evaluate the health of your community, like infant mortality or lung cancer, and they'll set goals, benchmarks, and say, we want to influence, we want to increase the number of tests for radon in our county. And then I'm providing data, that 15-year data spread, to each one of those communities for their individual community, so they have a baseline to work from. And in North Carolina, we have found that community health assessments typically do not have radon or radon-induced lung cancer included. So we have recently, in fact, on January the 28th of 2026, we'll be recording a multi-agency presentation about how the data is in the North Carolina data portal that is used for community health assessments. So that's just something we're working on. And this is what the data portal has. It has geological maps, it has specific fact sheets, it has testing data, and so forth. So if you are interested in engagement in South Carolina, I think that my counterparts there would be more than happy to have persons interested in getting the word out. So I thank you, and I certainly am open for questions, and appreciate your time. This is our my contact information. So my email address, that's our website that is big and bold in the middle. And again, we have social media images, videos that are in 7 languages. We have brochures in 16 or 17 languages. And with that, I thank you.
Well, Philip, thank you. It was a very all-inclusive lecture, and I learned a lot, including the fact that, being high above the ground doesn't necessarily protect me from radon exposure. when we talk in terms of acting, um, what is the mechanism to get a radon kit? And I suspect, like everything else, it's, potentially um, a situation where some of these kits don't do what they say they're going to do. So where would be the best resource for us to get testing, not only on the air, but also on the well water?
Sure. Great question. So there are five test kit companies in the United States that they manufacture their own device. Those devices have been evaluated at the National Chamber, which again is at Kansas State University. So the margin of error and knowledge about the efficiency of those test kits have been determined, which gives me, us, and every other state and federal agency confidence that the test kit is a viable way of testing. So the I know that I'm blanking on one of the names right now, but if you went to our website, there is in fact a link for radon testing, and that has the five companies there, and we put those there so that people can shop, right? And because some test kits have, it's all inclusive. You're getting the kit, you're getting the analysis when you send it back. And in the case of a couple of them, the postage is already paid, it's already self-addressed. And so you just put it back in the mail. As long as you follow the instructions in the kit for each one of those devices, you should have confidence in that test result. But I want to make a point of what we communicate, and I think others do too, and that is if your first kit or your first test has an elevated radon level, we recommend that you follow up with a second just to validate that test result.
Right.
And you can take the average of those two, and you're going to test in exactly the same spot as you did the first one. Now, if you want to hire somebody, again, there are people who do test. And I guess what I could do at this point, and this would be helpful, I think, is just to show you the website to give you an understanding of where to find this information, because sometimes that is problematic for some folks. So sharing this, I'm going to our website, and that's the web address that I shared with you. So on our website, and I'm not going to go into great depth about the website, but of course the brochures and resources that I've shared with you. But if you scroll down to testing for radon, then these are the companies that actually manufacture and conduct the analysis with their own test.
Very helpful.
Yeah. Now, the other thing that people have been doing is they're buying digital radon monitors, these devices that test hour by hour. And the national organization that every radiation program, state program, is a part of is a group called CRCPD. And what they've done is they've created a fact sheet about the use of those plug-in devices, because not all of them are devices that we would recommend. And then in terms of the directions, certainly we have instructions here on how to use it. But if you're going to hire somebody to come and test, which is going to cost you, in North Carolina, the average cost is about $250, $200 in some cases. And what you'll do is you'll go to one of these organizations. Inspector Nation, I believe there are people who work in South Carolina because they work on the border, North Carolina, South Carolina. But each one of them has their own search mechanism for finding a certified professional. And this applies also to mitigation. So the first two organizations actually certify people for mitigation. And just to point out, for mitigation, if I go to radon mitigation, there's a video that's here that provides more visual of what a system may look like. But really, the important thing is that if you are going to hire somebody, then because in North Carolina, in real estate and most and services, it's let the buyer beware. I mean, that's the policy that we have in North Carolina, right?
Right.
You buy a home, let the buyer beware. So you have to get some information to guide you. And this is intended to help you understand, um, who should I hire? It's going to show you those links that I just showed you. But also, here's a number of topics that we recommend that you address with whomever you hire. And when you click on it, it expands. Oh, I'm so sorry. It expands and gives you some questions, right? Do the contractor's proposals include these things? So again, this is about consumer protection, consumer empowerment, trying to make sure that you have things in your contract. Um, and it's just trying to be helpful in terms of guiding folks, listing basic installation um, components.
Well, you've done a great job of amassing all of this information in a very digestible form. So we appreciate that. I suspect that the South Carolina Department of Health and Human Resources has similar capabilities, but if not, just go to the North Carolina site to find these resources. Again, this presentation has been Zoom recorded and will exist on our website. Again, that website is cancersurvivorspark.org, and under the program section. Hopefully, while you're there, you can look at some other programs that we provide for our patients as well as their caregivers. But we also are doing a public health um, capability as well. And so we follow the various tenets of lifestyle medicine to include a plant-based whole grain diet, exercise, avoiding toxins, specifically alcohol and smoking. But in our case here, if we can do something about radon as well, social connections, getting good sleep, and a number of mind-body techniques. So we will end with a quote, and this to me is a penultimate quote about prevention, and it comes to us from Desmond Tutu in South Africa. And he says, there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. So, Philip, thanks again, and everybody have a great weekend, and we will see you next month.
Thank you.